Most people imagine a life-threatening injury as loud, blood, screaming, panic, but the most preventable death in trauma is almost completely silent. When a person loses consciousness, their body stops regulating itself. Every ounce of muscle tone instantly disappears, right down to the tissues of the tongue and the throat. This anatomical cross-section shows exactly what happens next. The muscles lose tension, and the heavy tissues of the tongue and throat collapse backward under their own weight, entirely sealing off the airway. There is no struggle and usually no noise, but permanent brain injury from oxygen deprivation begins in a matter of minutes. The cause of this obstruction is purely mechanical, gravity acting on dead weight. That means the fix is mechanical too. It requires zero medical equipment and relies entirely on physical leverage. Because the root cause is structural rather than systemic, anyone with two hands can physically move the blockage and stop a preventable death. Phase 1 is recognition. You need to get physically close to the person's face to look, listen, and feel for air. Look at this skeletal comparison. On the left, we see genuine, deep ribcage expansion. On the right, it is just the clavicle and shoulders elevating. That shallow twitching often mimics breathing, but it pulls no actual oxygen into the lungs. Next, listen closely to their mouth. If an unconscious person is snoring, gurgling, or making crowing sounds, they are not resting. They are choking on their own anatomy. The absolute worst-case scenario is complete silence combined with zero actual movement in the chest. That is a total obstruction. The human instinct is to equate silence and stillness with safety. The most critical skill in trauma recognition is overriding that instinct. Once you identify the obstruction, you have to manually manipulate the head to bypass the blockage. To perform the standard maneuver, anchor one hand firmly on the person's forehead to tilt the head back. At the same time, place the fingers of your other hand under the bony ridge of their chin and lift upward. This cross-section shows the internal mechanics. Pushing the forehead back and lifting the chin stretches the neck tissues, dragging the collapsed tongue forward. Instantly, you feel physiological feedback, a sudden rush of breath moving through the newly opened passage. If you suspect a cervical spine or neck injury, tilting the head back is too dangerous. Instead, you use the jaw thrust maneuver. In this vector diagram, notice how the cervical spine remains completely immobilized. To do this, place your fingers. Both of these maneuvers manually override the effects of gravity and lost muscle tone, instantly restoring the biological pathway for oxygen. Now you must secure the newly opened airway. This phase is non-negotiable if you are going to safely walk away to call for help. If you leave an unconscious person flat on their back, the airway will collapse again the very second you remove your hands. To prevent this, roll the patient into the recovery position. By bending one of their knees and extending their opposite arm, you create physical levers that move their dead weight onto their side with almost no effort. This top-down perspective shows why the recovery position works. Angling the mouth downward forces pooling fluids to drain safely to the floor. Inside, gravity passively holds the heavy tongue forward against the cheek wall, acting as a hands-free internal splint. Securing the airway transforms a precarious, hands-on emergency into a passive, stable condition, effectively pausing the timer on brain injury. The patient is stabilized. A catastrophic mechanical obstruction was bypassed using nothing but knowledge and your own two hands. Recognize the deceptive silence. Open the airway with structural tilt. Lock it open on their side. In the context of trauma, quiet does not mean safe. Quiet is the ultimate red flag. This channel covers what matters before help arrives. Subscribe if that is the kind of austere medical knowledge you want before you need it. While this knowledge buys critical time, it is not a replacement for professional care. In an emergency, contact your local emergency services immediately.